Our topic is Guillain-Barre syndrome, also known as GBS. GBS is a neurological disorder that affects the human body's immune system. This is where the immune system will mistakenly attack the peripheral nervous system, causing mild to severe damage to nerves located outside of the brain and spinal cord. This is a wide range of severity that is associated with this syndrome. GBS can have a mild severity and only cause weakness, or it can be very severe, causing complete paralysis. In some cases, patients do not even have the ability to breathe on their own. Individuals who are diagnosed with GBS will generally recover with having only a slight degree of weakness. So the systems that are affected with GBS is primarily the peripheral nervous system. And depending on the severity of the case, GBS can affect many different bodily systems. For example, since GBS causes muscle weakness, an individual may have swallowing issues, and this is where an SLP will come into the picture. It can also affect the respiratory system by causing individuals to have trouble breathing.
As you can see here, there's a picture of a normal nerve cell and a nerve that's affected by GBS. There is damaged myelin, which exposes the nerve fiber. There is no known exact cause of this disorder, but there are a few things that research has conducted that could be a trigger. For example, surgery, respiratory or gastrointestinal infections, certain vaccinations, and other viruses can be a trigger of this. Typically, the geriatric population is mainly affected. There are several effects on communication, cognition, and swallowing with GBS. GBS destroys muscles, nerves throughout the body, and this can cause extreme weakness in many areas. Many patients will experience facial weaknesses or have trouble breathing, and this can potentially cause communication and swallowing deficits. The brain may also receive abnormal sensory signals, and this could result in cognitive deficits.
As far as treatment goes for GBS, there's not really a set treatment that medical specialists use to treat this. It's really palliative care. We just treat the symptoms because the severity of the condition varies by each patient who has it. There are two pretty common treatment methods for GBS. One of them is plasmapheresis, which is a blood transfusion, and the other is IV immunoglobulins. And the role of the SLP in GBS treatment varies due to the wide variety of severity in the GBS client. So we really don't know how bad it's going to be until we do an assessment, and the patient could get worse and they could get better. We just really don't know. In the media, GBS is shown to be just a fast-acting syndrome that causes muscle weakness. It doesn't receive much media coverage, but there are some pretty related associated infections. They include respiratory and gastrointestinal infections, herpes zoster, which is shingles, glandular fever, and viral hepatitis. And all of the previous mentioned infections are typically accurately portrayed in the media, but GBS is just portrayed as like a muscle weakness in parts of the body and not necessarily the entire body. But again, that does range per patient. And then here is our reference page. Thank you for watching.